and maybe something else wrong. Because usually people say that after 6 months, everything is healing and you can run like a marathon runner. No, after 1 year, I'm not afraid to run because if you fall down and you hit it, you're doing more damage.
A year after hip surgery, Anselm thought he'd be back to running by now, but instead of returning to the trails he loves, he's still dealing with pain. A year post surgery, he has questions. Why is it still hurting? Is this normal? And will he ever get to run again? Those are questions many patients face after hip replacement. So, what does recovery actually look like? We talked with Calgary orthopedic surgeon Dr. Jason Werle to find out. Do most seniors get back to their previous level of independence?
They do, yeah, and it's it really a life-changing operation for most people, where it takes the pain away, their quality of life improves, and they can resume regular activities. There are activities that people can't do, like certain court sports, or running is difficult with a hip replacement. But having said that, people can play doubles tennis and cycle and golf and bicycle and hike, and pickleball people play as well.
Why not running? Because that was one of the typical things that, this person
Hmm.
had asked. He was a
Yeah,
avid runner before, and you
yeah.
mentioned a lot of other things that I thought would be more difficult, like the action of
Hmm.
pickleball. Why not running?
Yeah. With running, the running is the activity that causes the most loads across the hip, and especially if one stumbles when they're running, it can be about 25 times body weight potentially.
What level of pain is normal, and when should somebody be concerned?
Yeah, really, the vast majority of people are pain free. 90% of people get complete pain relief after a hip replacement. There's 10% of people who still have some discomfort, but it's usually less than what it was before the surgery. So if people are returning to activity and it's causing pain, it's probably telling them that it's a bit too early, or they're not, their technique isn't as good as it could be. And so probably best in that situation is to ease off it, make sure that you, have the discomfort settle down, and then reintroduce activity in a graduated fashion. The operation. And so I think what challenges